Why have I quit my job? Why have I, bought a van? And why am I going to drive around the country? Well, I'm passionate about the idea that you need to be heard. And I want to stitch these stories together across the states. We're going to find the commonalities. And it's going to be really an amazing experience. And I look forward to you joining me on the jar. Good afternoon, everybody. Welcome to Mental Health Today. I'm your host, Ken Stearns, and that was a little overdub of me chatting, maybe 30 months ago, kind of pontificating and imagining what I would find out there on the road with the JAR podcast, where I went to about 96 cities, interviewed 330 people across the U.S. Amazing experience, and, brought the mental health crisis up front and personal to me. So I got to sit and listen to people's real stories. Real people, real conversations. Halfway through that, I started this podcast it's almost 14, 15 months ago. Got about 150 shows under the belt, met some amazing people, heard some really cool stories about, mental health and what people are doing, their part, kind of in the crisis that we're in, and what people are doing to kind of help from their angle. And it's been great because we've gotten a lot of different views, a lot of different touch points on mental health and where it affects people and, how it touches so many parts of the lives. Jacqueline Tomsic, our next guest, really interesting, story. A part of one of the questions I've got in the jar, and I use it in my cards, is when was the last time you looked at yourself in a deep stare in the mirror? And so I think, I think we often look at ourselves, maybe when we're younger, a little more critical of how we look. And then I think a little bit as we get older, maybe we're a little bit more accepting, I hope. But there are definitely some other things that need to be, kind of fixed up in that area. And Jaclyn does a lot of work, facial work. And I don't want to say, I got it wrong, not dental work, but what was the help me out, Jaclyn?
Oh, yeah. So I am an oral and maxillofacial surgeon.
Maxillofacial, that's the word I couldn't get out.
Yes. So I do everything in the maxillofacial region, which does include inside the mouth and dental related. So definitely also appropriate. So
yeah.
But
who are your patients? What kind of patient finds you, or do they come searching for you, or they sent?
So I'm a specialist. I'm a surgical specialist. I'm a dental specialist. And a medical specialist. So we get patients usually from other doctors. We get a lot of patients referred from our local dental colleagues for anything oral and maxillofacial surgery related, which includes wisdom teeth, extractions of any kind, dental implants, oral pathology, oral infections, oral or facial trauma, facial reconstruction. So we really do, and that's where our whole really full name, we're oral and maxillofacial surgeons. That's where that comes from. So the oral is the mouth part, and then the maxillofacial is the rest of the face, the jaws, the facial skeleton, and what we call the facial envelope, the soft tissue covering of the face.
So even do you get into the sinus area or?
Sure. Yes. There's four. Yep. We get into mainly the maxillary sinuses and the frontal sinus, which is in front of the forehead. There are four paired sinuses of the facial skeleton. I would probably say the other two sinuses are smaller. They're kind of like behind your nose. That's really more my ENT colleagues, but we do deal with facial sinuses to a degree. Yes.
Doing a lot of trauma work.
Facial trauma, any trauma basically of the facial bones. There's upper jaw and the lower jaw are probably the most common, but also the nose. The nose is a very commonly injured facial bone, the cheekbones, the bones around the eye and the forehead. So the entire maxillofacial skeleton, we have experience in treating.
I'm a 3-time broke my face Olympian. gold medal and smashing my nose into a million pieces. I've got a couple of spurs up in somewhere in there, a little bit not deviated and something else going on. And back in the day, I used to go visit a guy. We had an affectionate name for him. I won't share, but he used to drain my sinuses.
Oh,
And that,
sure. I mean, I don't do that. That's more, like I
that's
said, my
more ENT. It's
ENT
an
colleagues, but yeah.
Yeah, yeah, it's an ENT thing, but it would definitely we had to go through the nose and, into the sinuses, and that's not a it's not a really pretty thing when your sinus your my nasal cavity was not exactly straight. Um, but really, you must have seen some miraculous changes in people. I think you're probably, pulling a wisdom tooth is one day, but another day would be really helping somebody change how they look.
Yeah, I mean, every day is definitely a challenge, and it's fun. Exactly. We change people's looks both
Yeah.
by replacing missing teeth. That's a big thing, dental implants and replacing missing
Mm.
teeth, but also repairing broken jaws or even repositioning jaws. So, yeah, absolutely. We see a lot of transformations, even as simple as like Botox injections that changes people and that they're very happy about.
It is. It's kinda cool kinda cute. So the word I wanna use actually is kinda cute that you can come in and just get a little couple of injections and change the way you look a little bit and walk out feeling better.
It's all about feeling better, especially with something like that. And we're talking about mental health. So obviously, anything that improves someone's vision of themselves or their
Yeah, yeah,
confidence in themselves, however small that may be, is definitely going to have an impact on their mental health as well.
yeah, 100%, 100%. Do you ever get the chance to do I mean, what kind of, what kind of homelessness work or charity work does happen? Is there any of that for dentistry? Does that, how do we
I mean, there always is. It's
so
hard.
is there is that gotta be
There's
hard?
local. Every year there's different clinics across the country in every state that treats, underserved populations,
Yeah.
usually like a day where, just volunteer. And I've, participated with those throughout the years as an oral surgeon. Like I would mainly do like tooth extractions, but there's other,
Mm,
you know, dental providers that a lot of them will do like dental cleanings or, just exams, oral cancer screenings, that kind of thing. A lot of what we do in
mm.
residency is for the underserved population,
Yeah, yes, yeah.
obviously. Um, you know, as in a more, private practice hospital setting, it's harder really to, those patients don't always come seek treatment,
Mhm.
but also everybody's trying to run a business, so there has to be some kind of compensation in order to keep the doors open. But
Yes, yeah.
there's definitely a lot of programs across the country that definitely help to serve that population for sure.
Yeah, I was thinking that's gotta be a tough one. Um,
Yeah, I mean it's always tough. You want to help everybody when you can.
that's a hard one to help though. It's, pokey on the outside. It's kinda pokey, and you're right, you wanna help it, but it's also kinda pokey and prickly, so it's you need the right approach. Um
Sure.
Yeah, so I'm kind of curious about those you coming back to that the idea of looking different and being changed, both for me it's more about having an accident and waking up and seeing your face look like different, that's not me. And how just that right there could send people down a real bad into a bad place. Um you must, and how do you talk to patients to get them to get their head on that, here's the steps, here's the processes. We're going to take you from looking like this to your old self.
A lot of what we do is managing expectations and also
Mm,
presenting realistic expectations for what we can do. I mean, um, but in the simplest forms, we see, a lot of patients who come in, on the dental side who are unhappy with their smile. Obviously, there's a lot of
okay.
patients for many reasons. Some could be because maybe they never had braces and so their teeth are crooked. Some people have just rampant decay and just, soft teeth, or just really haven't taken care of their mouth.
Hmm.
We see a lot of people who, are very conscious about their smile, and they don't smile. So obviously that's very important, and that I'm sure most people can hopefully easily see the connection between something like that and your mental health, um, and how definitely that can affect it, because if you're not confident with yourself, that you're not gonna.
Oh yeah, end up with a little bit of anxiety and social situations, and yeah,
So I always just like to encourage people to, the first step is coming in to see us, and to have a conversation, because a lot of people are embarrassed to see us, like, oh my gosh, my mouth is so bad, like they don't want to show anybody. And I try to encourage people, well, given the nature of my industry, I pretty much
uh,
see bad mouths every single day.
yeah.
So
So
there's
yeah, you're not that
really
bad.
not much that I haven't seen. And just try to present it as like, not, this is like a safe
Yeah,
space, non-judgmental. I can't change what's happened up to this point. I do have to evaluate it. So I'm gonna look and determine what the issues are, but our whole goal is to improve and to find a solution for you. And
yeah.
every patient is not the same. There's the good thing with technology, with just the advancement of medicine and dentistry, is that we have a lot of options now, a lot more options than we had even 10 years ago, to completely reconstruct, a mouth,
Yeah.
give someone a new smile, or do any kind of facial construction surgery that's repositioning. We use pretty much virtual surgical planning, where we like plan the entire surgery before we even do it on a
Mm,
computer screen. So we really do have a lot of different tools that we can use to help people.
wow.
And there's more and more things coming out. Like even this year, I'm, kind of very
Yeah.
involved with my implant company and the new ideas coming out. We're always, obviously, a lot of these things do cost. I mean, unfortunately, nothing is
Yeah.
free, and a lot of,
Yes.
and I always, I try to tell people, it's an investment in yourself, and it's investment in time, and it's investment in money as well, and you have to look at it
Mm,
that way, because again, a lot of these, full facial or full mouth reconstructions, they're not like overnight things. Like they take planning.
yes.
Sometimes we can do like some, major parts of the surgeries in one day, but there's healing involved in that. Sometimes
Hmm.
there is multiple phases before we get to an endpoint. So that's why people have to understand that, we can get you there. We'll be with you every step of the way, but it does take time. That's the first kind of thing to get patients or clients or people
Okay.
to accept. And then the second thing is the investment, because there is going to be a financial in investment as well.
Yeah.
But the good thing is, there are more options coming out now that are more affordable, at a lower price point, for more
Mm,
achievable for patients. So that's something that's really exciting, because we want to be able to provide people with options.
yeah. I just a couple of thoughts. One is kind of more dentist related, but the metal in people's mouths. Any advice for people sitting, listening that still have some old fillings?
I mean, again, I don't have anything against metal in the mouth.
Okay.
I assume the metal that you're talking about is the amalgam
Yeah.
fillings
Amalgam. Yeah.
within teeth. I have
Yeah.
some in my mouth right now.
Okay.
And again, that's not really my wheelhouse, but
Yeah. Yeah. It's not. No,
I
it's just on the
also,
edge.
if someone, so, but related to me, if someone came into me and said, I want to pull my tooth because I have a silver filling in it, well, first of all, I would not do that if it didn't need to be pulled, and I would refer them to their dentist and have them talk
Yeah.
about, changing out the filling. I think most dentists these days do not do the silver fillings anymore.
Yeah.
Uh, how, However, again, I think the studies show that there's a very, very low risk of any kind of toxicity or
Yeah.
any kind of really long-term issues. Like I said, I mean, I know at least one amalgam filling in my mouth. It has been there for 20 years. It
Yeah.
is doing well. They are very, very effective and very functional um, restoration.
Yeah.
They work very well. So there's no reason for me, and I'm not gonna go change it out just to change it out, I guess. So,
Yes. Yeah.
um, there's always going to be outliers. I guess the good thing going forward is, like I said, I believe that most dentists don't do that very much. Most modern dental practices don't do a lot of the amalgam fillings, but I'm pretty sure that some of them still do because it
Yeah.
is still a very effective form of treatment. And I mean, if we're talking, dollars and cents, it is cheaper.
Okay.
It's
So it's cheap. It's more economical for somebody. Yeah. Yeah, that was one I always wondered. I'd read that somewhere at some point, and when some of mine were falling out or kind of getting old, they were replacing them with, like a porcelain.
Yeah, that's pretty much, I think, the standard of care now. Like if you're replacing them or new ones, they're always going to be the tooth colored ones. But
Yeah,
if you have existing restorations, silver fillings in your mouth that are not leaking or perfectly healthy tooth, there's no reason,
yeah.
to change that out.
How did you how did you end up in this spot? When you I'm sure it must be a curious story.
Oh, well, yeah, didn't really know what I wanted to do as a career. I had been kind of thinking medical doctor,
Okay.
something in healthcare, you know. So I kind of settled on dental school in undergraduate. That's what I was going to do. So that's kind of what I did. And then um, I was in dental school, and we have different rotations in the different
Okay.
departments and different specialties. And so I was doing my oral surgery rotation and, really didn't know much about it, but really just took a liking to it. And then I had some really good mentors who
Yeah.
really encouraged me to pursue it because I honestly never would have thought to pursue it at all. Um, and then I just found out that I really enjoyed a lot of very common way that you'll hear oral maxillofacial surgery or oral surgeons described is that we are kind of like the crossroads between medicine and dentistry, and that is very, very true because we are a dental specialty, but we also have a very strong medical background. Many of us
Hmm.
also go not only to dental school, but to medical school, which is what I did as well. So we really know how to treat a patient as a whole and really understand not only what's going on in their mouth, but
Mm.
how that affects the rest of their body or how their systemic issues
Yeah.
are affecting their mouth. And that's really something that I think is so awesome about our specialty, something that I really like. So that's what kind of led me. I really, really found myself liking that. Um, Knowing that medicine part of it, I really enjoyed medical
Yeah.
school.
Interesting.
And to get to kind of like do both to me is like really cool, a privilege every day. Obviously, that's a lot of school, but I liked it, so worked out.
Yeah, 'cause that would be key. If you were having fun, then I think it makes a big difference. How about your practice? Tell us about the practice you're in.
Yeah, so I work in just private practice, which is pretty common for all surgeons for
Mhm.
my specialty. So I work in an outpatient clinic setting. Most of our surgeries are outpatient surgeries, so we're able to perform a lot of surgeries in an outpatient setting. Very unique about our specialty is we also perform anesthesia. We have significant anesthesia training as part of our residency. So we're able to actually perform anesthesia on our patients, deep
Okay.
sedation. So we do a lot of that in the office setting. Um, and so that's kind of like my day to day, but there are surgeries that, we don't do in the office. We have to do in a hospital setting.
Okay.
I take call for a hospital for anything oral surgery related, which can be anything from trauma
Yeah. Wow.
to
Wow.
significant dental infection. That's something that's pretty common. Unfortunately, there are a lot of people that don't have regular dental care, and so they have bad teeth, and the problem with that is it can become very infected, and it can lead to not only an oral abscess, but a facial abscess as well. And when those get to be pretty significant, they need to be treated in a hospital setting. That's usually when they present. So, that's something that really
Ooh.
is essential. Really, I kind of learned that during COVID for sure. Is that that's an essential
Yes.
job.
Yeah.
You can't let that go because it's an infection. An infection anywhere can spread through the bloodstream, but an infection in the face can not only spread through the bloodstream, but just anatomically, it's near your
Yeah. Your lymph.
airway,
Yeah.
and
Okay.
it can obstruct your airway, which,
Oh,
I mean, in the most extreme of cases, patients can lead to
yeah.
death if
You
it
could
closes their
suffocate.
airway, that kind of thing. So that's why it's very essential. It's very important. And that's something that we do.
You mentioned the implants company. Are you making implants there? Did I get that right?
Oh no, I just
Or
am a spokesperson for my implant
oh,
company that I use.
okay.
So the dental implant industry is like taking off. It's booming. I mean,
Yeah.
it's $1 billion industry, I'm sure, and there's a
Oh,
ton of
yeah.
different companies out there. But I am a spokesperson for Strawman, it is the biggest implant company in the world, really.
Okay.
So no, they make them. I'll let them make them. But I use them and I promote, what they can do. And that's what I mean. Like, they're really on the cutting edge of always, rolling out new products,
Yeah.
new technology that can help, patients, can help doctors, and everybody in between.
What's the new implant? What's the new thing coming out? What's the 2025
Well, the
model?
biggest Well, I mean, the implant itself they did just come out with a new implant late last year. And they're just always
Yeah, I'm
kind
geeking
of
it up, right?
improving on the system. Uh, but the big thing that's kind of really taken over the industry is what we call full arch treatment, which is
Okay.
when someone basically has what I would call a terminal dentition. So their teeth, there's not really anything else you can do for them. They're deteriorated. They can't. You can do a lot of restorative work, fillings and crowns and
Yes.
bridge and that kind of thing, but they really don't have healthy teeth anymore to
Okay.
support those kinds of restorations. So that's when we're removing all the teeth, and then we put implants to support
Mhm.
an entire, what we call, arch of teeth. So
Wow.
entire teeth. And it's called Teeth in a Day. It's called All on X. There's a number of different names for kind of like the same type of situation, but that's really become more and more standard of care, even more so over like a standard just denture, like a
Yeah,
denture,
yeah.
that grandma and grandpa had. It just comes in and out. It's in a cup on the side of the bed at night. That kind of thing. I mean, those things obviously still do exist. I'm not saying that they don't, but I do believe in the next 15, 20 years they will become more and more obsolete, just
Yeah, yeah.
because um, we know that the implant supported teeth are better all around for many reasons. They're better functionally. The patients, they're better for retention. The patients like them better. They're able to eat, you
Yeah.
know, better. They're also healthier for your bone. They're healthier for your entire system, because, people don't often understand this, or really maybe even think of it, but patients who don't have any teeth and maybe have just standard dentures, they can't eat the same type of foods that they're used to eating. And so that can have a significant or detrimental
Oh, right.
impact on just their entire health, because
Yeah,
if they're
yeah.
not getting
Absolutely.
the vitamins, minerals, nutrients that you need to maintain a healthy, you know, organs and lifestyle, that's really,
Mm.
has a huge impact. So being able to provide people with something that can allow them to maintain the type of diet that they have been used to their entire
Right.
life, if
Yeah.
they are
Interesting.
unfortunate and have to have, no longer have functioning teeth, that's a huge thing. So And that's where, kind of circling back, full circle back to like investment. When you think about,
Hmm.
and it's very hard. I mean, for most people, like, myself included, you look at something, you get a bill for like car or something, and it's like this huge bill, thousands of dollars, like, oh my gosh. Sticker shock, you have to take the time to do that and let that settle in. But when I tell people, I'm like, really think about everything and the investment that you're making in yourself. It's a financial investment, it's a time investment, but it's a quality of life investment as well.
Really?
It's significantly improving your quality of life for years to come. So that's why, it's great to be, it's very exciting for me to be kind of in the forefront, be
Yeah.
here and be able to, learn about all these new procedures, offer it to patients, and really kind of like spread the word about it. So, and it's an exciting time because we have so many more options for patients that even 20 years ago we didn't have.
Yeah. I still remember back when I was an agent, insurance agent, years ago, 25, 30. This got to be 30 something years ago. And I was in a car dealership and talking to a gentleman and taking his application and talking about the last time you were in, last time you had surgery, these kind of normal life insurance application questions. And he said, "Oh yeah, I just had a surgery." And he said, "I just had all my mouth, you know, all my teeth are
Mhm.
implants." And this would have been 30 years ago. So it was, pretty new.
He was definitely on the cutting edge. Yeah, if it was
He
30
was on
years
the
ago.
and it was all his teeth, and I thought that was a
Mhm.
thing. I just thought that's how you did it, and he was telling me each one and this is also when each one had its own drill post, and he said, "Best thing that ever happened to me, I still remember this, I could pull a freight train with my teeth."
Well, I mean,
That's how
that's
that's
very
how
important.
yeah, you
Yeah,
never know when
for
you're gonna need
sure.
to do that,
Well, hopefully not very often, but
but it did give you the
just
idea.
eating an apple, that's a good goal.
I think his point was, I could eat anything. My teeth are great. They're strong.
Yeah.
He was just so pleased with them. And that was 20, like I said, 30 years ago. And I thought, man, it can only have gotten easier for the doctors since then and the patients. Yeah, I
Oh
saw
yeah.
where, some of the stuff I think I saw where it's something like four, you could do a whole arch with four drills, four plants,
Or
or
implants. So that's something again, another term is all on four. So all the teeth, what that stands for is all teeth on four
on
implants.
four drill or anchors, I guess, implants.
We call them implants, yeah,
You call the
anchors,
implants.
posts, everybody calls
Okay.
them kind of like different, but they're implants and they're, strategically placed within the jaw bones.
Okay.
Um, and then the load is, spread over those four implants, and that's how we're able to, get a full arch of teeth on there. It has to have full support. Like so the implants have to be, properly spaced and centered. You can't have four implants on
Okay.
one side, obviously. I mean, just for obvious reasons, and it's going to torque and rock and things like that. So that's what the original, what quote all on four is. It's evolved now. It's all on X. X meaning like as many implants as we can fit,
Okay.
because the more the better. I mean, just kind of um, common sense, I guess, is if you're trying to support an arch of teeth on
Yeah.
a number of implants, the more support you have for a load, the better that's going to be, the less chance of fracture, the less
Yeah,
chance of
especially if
breaking,
teeth are grinding this way, that way, for like this, as
right?
you
The different
chew.
forces that are placed
Okay.
on them. So the minimum that we
Ah,
can do is four. And
okay.
that, because if we, and it depends, again, I don't want to get into like too many details. It depends on
Yeah.
the arch, it depends on the situation, but, you know, we have to have a minimum of 2 to 4 in order to equally spread the forces.
Yeah. Yeah. Especially when you're drilling it in. Interesting. Yeah, that's a little bit down the road. That's a little techie for the a little techie for the mental health side. But it's really, I
Yeah,
mean, it's fascinating. I think a lot of people are fascinated by just how it works. Yeah,
yeah, for sure. I mean,
to try to imagine.
yeah, and people don't realize, and that's why I always encourage people to come in and talk to us, because there is a lot of media out there, on television, different places, that kind of has gotten the word out.
Mhm.
Um, but it doesn't really go into detail. Obviously, like a couple minute segment on something is not going to give you all the details about intricacies about a procedure. So a lot of people don't realize that they have many options, and
Mhm.
each case is different. So it's really important for you to have that discussion to find out what is best
Yeah.
treatment for you.
I
I
think
mean,
that's
I often
great.
tell people
Yeah.
a lot because people see the commercials on TV for like teeth in a day, and they're like, "Yeah, I want that." And
Okay.
um, some people need it, and for the people who need it, yes, obviously. But there's a lot of people who come in, they're like, "Yeah, we saw that. What's this all about?" And I'm like, "Well, you actually don't need that, and to not need that is actually a good thing
Good
because
thing.
that means you have healthy teeth." And it is great. I tell patients this every day of my life. It is great that we have all these options, but there is still nothing better than your natural teeth. There will never be anything better than your natural teeth. And if it is reasonable to
Mm,
save your natural teeth, even I am always going to say that. I mean, I would never, I mean, I hope I never have to lose my teeth.
yeah. Yeah, it's interesting, right? What a great way to, kinda, look on the wrapping of the conversation up is at the end of the day, nothing is better than what the original equipment,
I
designed
mean,
for our
it
mouth.
is true. It's
Uh,
it's true, but again, like I said, it's great that we have all these
we have
options
options.
because um, you know, that not everybody is blessed with being able to keep all their natural teeth their entire life. So,
Yeah, I was not gifted. My brother had some better, it's like, I don't know if it's genetic or not, but, yeah, my teeth not good and probably didn't take the best care of them. Um, and I'm sure I'll have a replacement at some point, an implant at some point. Speaking of which, how do people find you?
sure. I mean, so I practice in the Cleveland area. I don't know if you're local. I practice in Independence, but online, you can find me on Instagram. My
Okay.
tag is Dr. Jackie. I have a website, just jacquelinetomsic.com as well. Um, but yeah, I mean, probably, or LinkedIn. I also have a LinkedIn site. So all of these social media platforms are easy ways to get in touch with me. And I'm always happy to speak with anybody about what I
Yeah.
do.
Well, Jacqueline, thanks so much for speaking with us and sharing what you do. Very interesting. And I said I'm tangentially follow teeth stuff because of my teeth are okay, but there's times when I know I'm going to need some more work. So I'm always interested. I don't know what it is, but dentistry is an important thing, right? It's our mouth, and it's something we use all the time. And how we look, right? To be able to have options on kind of changing, or
I mean, a lot of
improving how we
people
feel.
really I mean, there's a lot of people who think that dentistry is just cosmetics or teeth are just cosmetics, and
Mhm.
I mean, that's like I said,
Yeah,
we're talking about mental health, and that's very important, because if someone is, feeling some depression or anxiety,
right.
obviously, the last thing that they're gonna wanna do is, like, brush their teeth at the end of the day, so you can
Interesting.
definitely neglect your oral hygiene, which can lead to,
Yes.
tooth decay, gum disease, and other issues. So that to me is a huge kind of link between oral health
Yeah.
and mental health, and why taking care of your mental health is actually directly impacts your oral health in many ways.
Um, ab
But
absolutely.
also, remind people, the teeth, the mouth is the beginning of your GI tract,
Yes.
technically. So in
Yeah.
medical school, that's the mouth is part of the GI lesson, the GI system,
Yeah,
because it's the
yeah,
beginning of your GI system. And going back to that, what we were talking about how dental implants provide more support and you can have a
yes.
better function, you can eat more things. It all goes to gut health. Like if you can't consume the correct amount of or the appropriate amount of food and nutrients, your gut health is going to suffer as well.
Mm,
Your taste buds, you can lose taste buds if you're not getting the same kind of support, nutrients, and that kind of thing. So it's more there's a lot. It is very
yeah,
important. That was
yeah,
what I was going at. It's very important. And additionally, it's very important, again, aesthetics. That is very important. I also do a lot of in my field. We do a lot of studying on like facial proportions,
Oh, yeah,
what
yeah,
what we consider as beautiful and that kind of thing. There's, I mean, tons of very elaborate and interesting studies about that. But again, it's not necessarily what someone thinks of you; it's what you think of yourself. And if self confidence is so important, and if
yeah,
your teeth, your smile is, is really affecting or bringing down your self-confidence,
yeah.
I mean, that's huge. And that's going to affect your mental health in so many ways. So it's very important that, it's not just aesthetics. Like, and aesthetics
It's
mean so
not
many
just
things to different people. Not everybody wants like white teeth. Not everybody even wants straight teeth. They just want to be
mm,
confident in their smile. And there's so many beautiful smiles. And what I tell people, and you know this, everybody knows this, doesn't matter like anybody, if you smile at somebody, like all these studies show, like just smiling at a stranger has how much impact it has, like on the endorphins that you
yes,
produce.
it's
Like,
actually crazy.
yeah, like
It's cra
smiling at a
yeah.
stranger walking down the street can literally change their day. You don't know them,
Yes,
you'll never see them again. And so like just that simple act, and it has nothing to do with like what your smile looks like, how straight your teeth are when you smile. It's the actual act of smiling. And that's where it goes around. Like if someone
I love
doesn't
that.
feel like smiling, if they're not confident enough to smile, then they're
Mm.
not,
They're not
so
spreading
it
joy, Jacqueline, they're not spreading
no,
joy.
I like to spread joy,
Yeah.
so
Well, and if you don't think the teeth if you don't think it's important, just imagine how big the teeth whitening industry is. Like, how much product sells because it says teeth whitening on it.
oh, for sure, for sure.
So,
I mean,
that's a billion that just alone is a billion-dollar business right
it
there.
is. Yep.
Well, and I love this. So the episode could be the smiling episode.
I
That's
like that.
the best part. Yeah, and if you don't think your teeth look great or anything else, just look at a baby. They smile. They don't hardly have any teeth. They have sometimes they
No,
got
and no,
2 sometimes
and
they got
babies are
2
like the
butt
cutest things ever. No,
cutest things ever.
there's
Yeah,
no
they
one says
smile.
ugly babies.
Yeah, they'll say ugly. Oh, that baby's got ugly teeth. It's, even though they got 2 fangs and a couple of things hanging down to the pink stuff, and babies smile all the. They say they love, and they love smiling at themselves. They love themselves in their own photos. So I think for all of us listening, we can love yourself a little more, love your smile a little more. Jacqueline, thanks so much for
Yeah.
being a guest.
Thank you for having me. It was such a pleasure to be here. And, I hope that this resonated with at least one person out there.
That's it. All we hope is one. All we hope is
Yeah.
one. And if that one is on an audio version, please drop down on Apple or Spotify or iHeart or wherever you're at and give us a rating and make a little note. Read all those and really love them. Jacqueline, hang on for 20 seconds. I'll see you on the other side.
All right. Great. Thank you.
Yeah, loose, baby.
But we're about to go and make this vessel with these great professionals at Public Glass. We're not part of the community, but we're from the outer family of glassblowing. Yeah, we're gonna go make a magical giant jar with optic lenses so that if you turn it, it changes all the time. So if you change the way you look at things, the things you look at change.